Imagine this, you've got a bachelor's in business, IT, or even engineering. But 2 years from now, you'll be working in scrubs as a registered nurse in Australia. Sounds crazy, right? But that's what the Master of Nursing pre-registration course is designed for. And for those of you who are new to the channel, I'm a registered nurse based in Sydney, Australia. And in today's video, I'm going to talk about Master of Nursing pre-registration course. This program is designed for people who already have a bachelor's degree in something else, and now they want to become a registered nurse in Australia. But before we dive into the details, I want to clear up one of the biggest confusions that students have. The difference between Master of Nursing pre-registration and Master of Nursing post-grad advanced practice. Because trust me, they are very different programs. So let's clear up the confusion first. When you type a Master of Nursing Australia into Google, you will see so many results coming up, and it's so easy to get them mixed up. So let's differentiate between the two. Well, firstly, let's go over what Master of Nursing pre-registration course is all about. This is an entry to practice program, and this is for people who don't already have a nursing background. Think of it as an accelerated version of Bachelor of Nursing program, which is a 3 years degree. In Master of Nursing pre-registration, everything is concised over 2 years. And at the end of this course, you are eligible to apply for your nursing registration with AHPRA and start working as a registered nurse in Australia. This is what the Master of Nursing pre-registration is all about. Now let's go over what Master of Nursing post-grad or advanced practice is. This one is for people who are already registered nurses. This program is more about upskilling as a registered nurse. Maybe if you want to become a nurse practitioner or go into leadership roles or education roles, it helps you develop those leadership and management skills. So think of it like an upskilling course for people who are already registered nurses. And you cannot use this course to become a registered nurse if you aren't one already. So if you're someone who studied something completely different, let's say you've got a bachelor's degree in IT, engineering, or even business, and now you want to enter the Australian healthcare force as a nurse, the pre-registration masters is your pathway. I get so many messages from students who get so confused with these Master of Nursing programs. So that's why I wanted to clear it up right at the beginning. Now let's go into the details. Now let's go over the course structure and duration. Most universities in Australia offer this as a full-time 2 years program. And let me tell you, it's intense. In just 2 years, you'll cover, first of all, nursing theory, which includes your pharmacology, evidence-based practice, pathophysiology. Secondly, lab and simulation training. This is where you get to practice all the skills that you're learning in class, in theory, on mannequins and simulated patients. This is actually great because you get to practice all the theory that you're learning in class on simulated patients first, before you go for your clinical placements and practice on real-life patients. And thirdly, clinical placements across different settings, including hospitals, aged care homes, mental health units, and community health. You'll be doing hundreds and hundreds of hours worth of clinical placements. So it's basically squeezing the bachelor's worth of content in just 2 years. So the pace is fast and the workload is heavy. But the upside is you are in the workforce sooner. Instead of doing the 3 years full-time degree, you'll be working as a registered nurse in just 2 years. Next up, we've got cost and eligibility. Let's talk about the cost and who can actually apply. Well, for international students, the fee can vary anywhere between $30,000 per year to $45,000 a year. It just depends on which university you enroll in. And for domestic students, you might have access to fee help, which lets you pay your fee later through the tax system. So you basically don't have to pay your fee and the government looks after it. And once you graduate, start working as a nurse, they will slowly start deducting that money every time you get paid through the tax system. And this is only available to domestic students. On the other hand, international students have to pay their fee upfront every semester. In terms of eligibility, universities generally require a bachelor's degree in any field. It doesn't have to be health related. It could be IT, science, arts, commerce, anything. Secondly, English test requirements. It could be IELTS, PTE, OET. This is basically for international students who don't have English as their first language. And thirdly, meeting the academic standards. But there's generally a requirement of a minimum GPA from your bachelor's degree, which would be different for all the universities. So if you studied something else before, but you always had that calling to go into nursing, this degree is your chance to make that career switch. Next up, let's talk about placements and clinical experience. One of the most valuable parts of this whole program is the clinical placement. You'll be spending hundreds and hundreds of hours going from one hospital and one healthcare facility to the other, gaining a lot of hands-on experience in the real healthcare settings. And this is where you'll be sent into mental health units, community health, different hospitals, and different parts of the hospital. Could be theaters, could be ICU, emergency, medical and surgical wards, and sometimes even mental health units. Clinical placements are challenging. The shifts are long and you're thrown into the real-life situations pretty quickly. But this is where you learn the most and where you really grow into your future role as a nurse. And not to mention, you do the same number of clinical hours as you would in a Bachelor of Nursing degree, which is spread over 3 years. And mind you, this is just 2 years, but same number of clinical hours, which means it can feel more intense. I've worked with a few nursing assistants who have gone through this program and they barely had any time to work as a nursing assistant. And every time I spoke to them, they used to talk about how intense it would feel because they would have their assignments due in the same week and they've had like 6 weeks of clinical blocks. Even though it felt so intense, they were still able to keep going and they've graduated now, and one of them is actually working in ICU. And she loves her job. So even though it felt really intense, they were able to go through because they had the bigger picture in mind. I myself have done the 3-year degree and it felt really intense doing that. I can't even imagine how the 2-year degree would feel like. Next up, I want to talk about why people are choosing to go for Master of Nursing pre-registration program. So given how intense this is and people already know before they enroll, why would people choose this? Well, first of all, it's perfect for those changing careers. So even if you've got an undergrad in something else, you want to go into nursing, this is a clear pathway. And it lets you do that without having to do the whole undergrad again. Secondly, it's faster than a bachelor's. It's just 2 years full-time degree and then you're ready to work. And 2 years go like that, especially given how busy the degree is, you wouldn't even know that it's your graduation day tomorrow. And lastly, which is one of the main things, the job prospects are great, especially if you're based in Australia. Australia has an ongoing nursing shortage, so graduates are in high demand. And some people also like the fact that it's a master's degree and it looks great on your CV, which shows that you've got some other experience and some other transferable skills that you bring into nursing. And this can open so many doors for future study and leadership programs down the line. So the fact that it's actually a master's degree is a plus point. Next up, I want to cover some of the challenges. Well, I want to keep it real with you. This program is not easy. The workload is definitely heavier than the bachelor's because you're learning at a faster pace. I mean, I myself went through bachelor's and I thought that was heavy. I was trying to juggle my part-time working rights as well as my clinical placements and assignments at the same time. And sometimes I couldn't even make it to the 40 hours a fortnight that I was allowed to work as an international student because the workload just felt so heavy. But this would be 2 steps up. Placements can be physically and emotionally draining, and balancing exams, assignments, and your clinical placements will really test your time management skills. But if you're passionate about healthcare and helping people, the hard work is definitely worth it. And almost every graduate I've spoken to says it's so challenging, but it's also one of the most rewarding things they've ever done. So I just want to lay it out there before you make the big decision that it's a very full-on degree. It's not impossible, so many people do it, but you would rather be mentally prepared for the hardship than me trying to make it sound really easy. So that's the Master of Nursing pre-registration in Australia explained. If you are considering this pathway, let me know in the comment section below what excites you the most about this course. I would love to hear your thoughts and maybe make a follow-up video answering your questions. And make sure to hit the subscribe button so you don't miss out on any of my future videos around nursing and life in general in Australia. And I'll see you in the next one. Bye.